Good afternoon. We're here for the 2023-2024 open enrollment meeting for Reno County Benefits. My name is Helen and I'm with HR. So I'm going to start with introductions of our panel up here. So we have TJ. He's our new generalist with HR. So he's going to be your contact for any of your benefit needs and retirements. And then we have part of our USI team, which USI is our brokers. If you're not familiar with USI, they help us with putting together our benefits package and taking care of our contracts with our different providers. So who I have with me is Alicia from USI, and we have Darcy from USI. So with that, I'm going to go ahead and begin. We're going to begin with the 2023-2024 wellness plan. So that document is in your seats. If you want to pull that document, we'll start with the first page. And so if you flip it open, the back of the first page is going to give your login information. If you have not been participating in the wellness plan and this is something that you would like to do, just remember that you're always earning the benefit for the year. You're earning the benefit in the year prior before you receive the discount. So those individuals that participated in the wellness plan for this last year that ended on July 31st, this will be the plan year on health and dental benefits that they will see the discounts for their efforts in the wellness plan. With that being said, there's not a whole lot of change with the wellness plan this year. One thing I will draw attention to, if we can move over to the physical activity, which is going to be the actual back of the second page. When you look at the back of the second page, if you go down, you're going to see a highlighted area that says new. That is a 20,000 step requirement, 10 miles or 90 active minutes, or 120 zone minutes, and that will give you 15 points a day if you achieve that. So all of the other requirements are the same on the physical activity. It is 300 points each quarter. And with that, it's still there's still a requirement of electronic tracking. If you are utilizing any kind of Fitbit or any kind of device other than a Fitbit, such as Samsung or Apple, make sure that you get with Cody to go over the requirements for your submissions of your active minutes. With that being said, too, Cody will be your primary contact for the wellness plan. His information is within this booklet several times. If you have any questions about the plan or you need help setting up your app, he can help you with that. And then if you'll turn over to the healthy living side, it's on the back of page 3. The healthy living side has not changed for this next plan year. There are 3 preventative visits, and you have to meet all of these requirements: 3 preventative care visits, 6 lunch and learns, and 12 newsletters. With that being said, on the lunch and learn side, we do bring in outside presenters for those presentations, and so we're trying to encourage people to come to the in-person presentations. So this year, if you do come to an in-person presentation, it's actually going to count as 2 lunch and learns. So in other words, if you want to come to 3 live sessions of the lunch and learns, you will have met the requirement for the lunch and learn side. Are there any questions so far on the healthy living, physical activity? Okay, the rest of the information is the same. So with that, I'm going to turn it over to TJ, and we're going to start in your benefits guide.
Hi, so as Helen mentioned, I'm TJ. I'm the new HR generalist and program manager here. Just one thing I want to real quick mention is that I've left my business cards on the table next to the door. So as Helen mentioned, if you have any questions regarding insurance, capers, I will be your primary contact for that. Or if you're watching this video later on, I can be reached at tj.bales@renogov.org, or I'm extension 2988. So feel free to reach out to me. But as far as the open enrollment plan, or for the plan year, that started on August 14th, this last Monday, and that will go through Friday, August 25th. So it's better to start this process sooner rather than later. That way, in case you have any questions, or there have been some people that have had some trip ups removing a dependent or adding a dependent. So it's good to get those kinks out of the way so that I can help you and some of these other people involved can help as well prior to the very end of the open enrollment period. So the other thing I want to mention is that this is a passive enrollment. So if you are wanting to stay with the benefit selections that you had in the 2022 to 2023 plan year, no action is needed on your part. You only need to enroll if you're wanting to make a change, whether that be adding or removing coverage or a dependent. And then the only other thing I want to call attention to, if you go to page 6 and 7 of your benefits guide, you will notice that there has been a rate increase of 2% versus last year. The commission did approve a 2% rate increase with a 1% shift from the employer side to the employee side. So that said, we've had a good couple of years in terms of the premium. 2 years ago, we had a 3% decrease, and then last year we were flat. So everything considered, these are still very competitive prices in the market, but I just wanted to call your attention to that. And then, of course, as Helen mentioned, the activity that you did with the wellness plan last year will determine bronze, silver, or gold status for this plan year. But that's pretty much it as far as the open enrollment, unless anybody has any questions on that. Sure.
I don't know. I think I talked to you, maybe because I turned 65 in September, but I'm keeping this insurance. I'm not planning on retiring until I'm 66.5, which will be 2025. And they said something about if I enroll and get Part A, can I still do pre-tax? Can I do it the next year, or?
So the only thing and her question is about Medicare and coverage. So Medicare, if you're signed up for a Medicare plan, where it does have an effect is on your HSA. If you are signed up for a Medicare plan, you cannot contribute to an HSA, but it doesn't change how you take your deductions for your health and dental coverage. So you could still elect to have pre-tax deductions. The only difference is it does affect on the HSA side. So if
Have that. So with that being said, I'm going to say goodbye because I don't think I'm not going to change anything. But I can still enroll in Medicare, take Part A, and not have to do that.
yes, and Medicare with any active employer plan is always secondary. So your Medicare would be your secondary coverage. Our coverage would be your primary.
All right, so we don't continue because I'm not going to change anything. Okay? You guys are stuck with me.
Thank you.
Couple of moments.
Thank you.
Bye.
I have a question about the bronze, silver, gold tiers.
Okay.
So I've been Marine County for about a year, and I opted out of coverage last year, but I didn't do any of that healthy living activity stuff. So I was curious, since this is my first year opting into coverage, what tier I would fall into? Am I falling into bronze, silver, gold?
You'll start as silver.
It starts at silver.
Yep, and then you can start participating now in the wellness plan, and everything you do from August 1st until the end of the plan year for the wellness plan, which is July 31st, will then take into effect on October 1st, 2024. So if you complete both sides of the wellness plan, then you'll move up to gold.
I was just curious where I would start.
Yeah.
Since I opted out, I didn't know how that would affect me.
Yep.
I have a question. I don't want to make any changes, I don't believe, but my son graduated and has moved out of state. And I've already I called the 1-800 number, and they said because he's not in Kansas, he was not eligible for benefits. Is that correct? He lives in Arkansas now.
You would go to your rep, correct?
Do I need to enroll again and make changes, or am I good to just let things keep going another year?
I think this is probably something we need to navigate together, maybe outside of this forum. So if you want to get with TJ, we can do a reach out, but no, that's not correct. There's other provider networks that they would fall under, even if they're not in Kansas. So our providers network is nationwide. So that is not exactly correct. So maybe let's connect after this. Okay.
When did we find out about statuses?
So the letters will actually come out. We can't pull any reporting until we close the portal completely down. The wellness portal is due to be closed down around September 1st. And then from there, we'll pull the reporting and we'll compile that and we'll send out letters like we have in the past. The letters will have the tier level that you've achieved for this year. If you have any problems with the letter or feel like there's a discrepancy, just make sure you get with HR right away. But those will come out about mid to end September.
HSA changes,
And she's going to talk a little more on that.
like more increases and whatnot.
Oh, that's something that I'll handle. Yep. So any changes you're wanting to make will be through me. And sorry, go ahead.
So I'll go ahead and jump in then and run through the benefits in the benefit guide. As stated for the 2023-24 year, Reno County is continuing their relationships with Allied, Providers Care, Maxor, and ArrowRx. There are not any changes to the benefits on the medical plans, and you still have the same 3 options to choose from. You have a traditional PPO plan, a non-qualified high deductible health plan, and a qualified high deductible health plan. In order to receive the most benefit, you do always want to make sure that your providers and facilities are contracting in the Providers Care Network. And there are directions in the middle of page 8 for you to look those up if you need to. On page 10, members will still have access to Allied Advocate through Allied. This program ensures that members aren't overpaying for services and procedures. So after you receive medical care, you will get an explanation of benefits in the mail, and that will outline the services that you had and show you what you might owe. You're also going to receive a bill from your provider. It is very important that you compare the two to see if they line up. If your provider bill exceeds your patient responsibility on your explanation of benefits, or it's higher than your maximum out of pocket on your medical plan, it's important that you don't make any payments to the provider and you call Allied immediately. Likewise, if on that explanation of benefits, there's a highlighted box that says important message from Allied, it's important that you contact them immediately before making any payments. And then lastly, if you were to receive a letter from the hospital asking you to set up a payment plan through Commerce for services that you had, again, you will want to contact Allied before making any payments. At that point then, Allied will initiate the process to negotiate those fees down so that you're paying the least amount out of pocket as possible. So again, super important that you coordinate your explanation of benefits with that provider bill. And if there's any discrepancies, call Allied Advocate before you make any payments to the provider. That phone number is listed at the bottom of page 10. Also, the county is still partnering, as I said, with Maxor and ArrowRx. So the important thing to know is that if you are taking high cost medications, please be sure to work with ArrowRx. All of your high cost prescriptions must be sourced through them, and they're also available to answer any questions that you might have. So there are directions in the benefit book for you to register an account. You can also utilize their member portal and their member app as well. TRIA Health is another program that's available to employees, and it is a chronic disease management program. So TRIA's goal is that they will work with you to help you manage your health conditions. They also make sure that your medications are working as intended, and then they can help answer questions and even coordinate care with your physicians. If you have one of the chronic conditions, they will contact you, and it's absolutely worth connecting with them. Not only do you receive their assistance, but you also can receive free generic medications, reduce costs on name brand medications, and then overall, you're saving money on your healthcare. You certainly don't have to wait until they reach out to you. Again, if you have one of those chronic conditions that you think they could help with, you can call to set up an appointment, or you can schedule an appointment online. So that is another resource that you have available. When you're making decisions about your medical plans, it's important that you weigh all of the elements of the offerings that are to you. So there are 3 different plans available. All of them are quality plans. It just depends on what works best for you and your family. On page 13, there is a comparison provided which shows you the main differences between a qualified high deductible health plan and then the traditional PPO plan or a non-qualified high deductible health plan. If you do choose to enroll in that qualified high deductible health plan, one of the benefits is that you can open up a health savings account. So your health savings account is funded with pre-tax dollars, and you build up that account over time to help with your out-of-pocket expenses that you're going to have on the medical plan. You can also use money in that HSA account to pay for dental and vision expenses, prescription, over-the-counter medications, orthodontics, and so forth. The limit for an individual, if you're on an employee-only plan, that you can contribute to your HSA is $38.50 a year. If you have 2 or more on the plan, it's $77.50 a year. And if you're age 55 or older, you can add $1,000 to that. Your HSA funds will roll over to the next year, and there's no limit on the amount that you can roll over or for how many consecutive years that you can do so. If you want to set up your HSA because you've chosen a qualified high deductible health plan, you can visit with Helen or TJ. There is a form that you would complete, and then they will get you set up with an account through First National Bank, and contributions to that HSA will be made pre-tax through payroll deductions. Again, if you want to make changes to that, then you would also want to visit with TJ about that as well. Besides the tweak to the premiums and the change on the wellness program, the other change this year to the benefit plan as a whole is that the county will no longer be utilizing the Center of Values benefit. If you are using it currently, you can continue to do so through the end of September, but as of 10/1, you will be using the Fair Market Health benefit. Also, as of 10/1, Summit Surgical will be participating in the Fair Market Health benefit. So by using Fair Market Health, members that are on the PPO plan or the non-qualified high deductible health plan can receive a variety of services with no out-of-pocket cost. Employees that are on the qualified high deductible health plan will still have some out-of-pocket cost, but it will be significantly lower than if you weren't using the Fair Market Health benefit. You can set up an account by going to the website, and that is at the bottom of page 15. You're also able to access a full list of services, and that stays up to date on the Fair Market Health website. Members also can utilize Teladoc. Teladoc is a fast, convenient way to see a doctor virtually. You can have a live visit on your computer or your mobile device. It's a board-certified physician, and it's available 24 hours a day, 7 days a week. Those doctors can diagnose a variety of conditions and even prescribe medications when appropriate. So not only is it a convenient way to see a doctor, but it's also a lower costing alternative than seeking an urgent care or an emergency room visit. If you're on the PPO plan or the non-qualified high deductible health plan, it's a $0 copay to use Teladoc. If you're on the qualified high deductible health plan, it's a $55 copay. Teladoc can also be helpful if you're traveling or out of town. Perhaps you forgot to refill a maintenance medication. You could contact Teladoc and they would be able to assist you with that. Maybe you aren't feeling well and you're not sure where the closest in-network provider is. Teladoc, again, is available 24 hours a day, 7 days a week, and it's either zero cost or a copay depending on the plan you're on. On page 17, there are no changes to the dental insurance. It's still offered through Delta Dental. Your diagnostic and preventive procedures are covered at 100%, and Delta pays for 2 oral exams and 2 cleanings per plan year. They pay 80% on your basic services, 50% on your major services, and each person on the plan has a $1,500 benefit to use each plan year. Your plan also includes orthodontia for dependents under the age of 21. With the medical insurance, like the medical insurance, it's also important with dental that you are choosing a provider that is in the Delta Dental network. Delta contracts with over 95% of the providers in this area, so it's likely that you are seeking from someone that's contracting. However, there are directions in the benefit guide for you to look up those providers. Delta Dental also has a mobile app, and that is hands down the quickest way to access your ID card or any of your claims information. Your voluntary vision insurance is not changing, and it's still through Vision Care Direct. There are 4 plans that you're able to choose from depending on what your needs are. Perhaps you just need an eye exam, or maybe you need an eye exam with glasses and contacts. You have 4 plans to choose from, and the benefits and allowances on those plans reset every plan year. So each plan year, it reloads the benefit. You also have the option to purchase voluntary life insurance and accidental death and dismemberment for yourself, your spouse, and your dependent children. If you enroll when you're first eligible, the coverage is guaranteed issue, which means you don't have to answer any medical questions. If you're a current employee and you've waived in the past, you may enroll at open enrollment, but you will have to complete that medical questionnaire or evidence of insurability. And then lastly, if you're currently enrolled as an employee, at each open enrollment period, you can increase your coverage up to the guaranteed issue amount without answering any medical questions. This is also a good time of year to double check your beneficiary information. So if you've had a life change, when you go in to do your enrollment, you'll want to make sure that that information is still accurate. Short-term disability is essentially paycheck insurance. You can purchase that through the county and it's payroll deducted. If you have an accident or an injury and you're unable to work for a short period of time, the disability plan will kick in and pay you 60% of your weekly salary for a period of time. You can also purchase permanent life and long-term care insurance. And then lastly, you have 3 supplemental benefits available to you: an accident plan, a critical illness plan, and a cancer plan. These plans are designed to supplement your medical insurance. They pay benefits directly to you, regardless of any other insurance. You then can use that money to pay your deductible, pay your cost of living expenses, or any other daily out-of-pocket expenses that you might have. An accident plan is going to pay if you have an accident or an injury. A critical illness plan will pay if you have a covered critical illness, such as a heart attack, a stroke, or invasive cancer. And then the cancer plan is going to pay extensive benefits on cancer specifically. You also have access to the USI mobile app on page 23. This is an app that you can download to your smartphone, and it will have all things benefit related. Probably the most popular thing is that it can house your ID cards within the app. So if you go to My Benefits to Go and download the app, you can use the code provided in the booklet, and it will sync up to your Reno County benefits. If you have questions throughout your open enrollment or throughout the year, Obviously, Helen and TJ are available and can help you with pretty much anything. But if they're not, you also can use the Benefit Resource Center if you have questions about your benefits, your deductibles, or claim issues. There's a 1-800 number on page 24, and they have information regarding all of your benefits and can help you walk through that. You also have the Benefits Direct customer service. So as you're doing your online open enrollment, if you have questions on those specific voluntary benefits or you need help with your online enrollment, you could also call them at their 1-800 number. And then lastly, in the very back of the book, you have a list of benefit carrier contacts. Also included there is myself, USI, Alicia Davis Arnold. We are able to help you in addition to Helen and TJ now or throughout the year with any benefit related questions. Okay. Are there any questions on any of the benefits that we went over? Mm-hmm.
They call me and go over our minutes and all that stuff. Like, is that automatically we're receiving whatever benefits are coming from that, or do we do anything further for getting the medication reduction costs?
You would coordinate that with them. So when have they addressed that with you? Like, are you paying for the medication that you're receiving right now? You're on the high deductible health plan though, correct? So on the high deductible health plan, it's going to work a little bit different because you can't have that first dollar coverage. But I would assume that they would then assign and work with you if they had any options for like the lower cost generics, as opposed to maybe what you're taking. So what they do is they look at it and they would say, you're on this medication, but there may be these lower cost options. So it's possible that you're on the lowest cost option. You can get reduced and free generics, but on a high deductible health plan specifically, you can't have that first dollar coverage. The qualified high deductible health plan.
So how do I know if I'm getting the cheaper medication? Because they didn't really go over that.
If you're engaged with them, they've already applied that discount to what they can. So if they can't further discount, then you're probably not going to see anything.
All that, or what?
Yeah, it all passes through the pharmacy, through the PBM.
That's what I was just,
Mm-hmm.
I didn't know if
Yep.
that was.